I have a Leno Burn update, and I have some questions about his treatments, to be honest. So I'm going to kind of recap for everybody. So on November the 12th, Leno was burned. He was underneath one of his cars. There was a flash gasoline fire. He got burned on his face, hands, supposedly his chest. He went to a hospital. They deemed him as not life-threatening burns. He was transferred to this Grossman Burn Center, which is like this kind of concierge burn center, which I remember last, or however many weeks ago when we were talking about that, I kind of like raised my eyebrow at that because that's not like a normal thing.
Yeah.
And we'll talk more about that later. But so he was in there for 9 days. He was discharged on November the 21st. And now that he's discharged, there's a lot more information. One, they did some kind of interviews with that place. And I have some pictures of him that I want to show. All right, so picture on the left is his face.
Yeah,
and
his hand is messed up.
Yeah, I mean, it is and it's not. I mean, you know,
I mean, it looks better, I guess, than before.
Well, I mean, as far as burns go, like that's a pretty typical partial thickness burn appearance. You know, you're going to have like some discoloration. You know, I can see that he had blisters, but you know, you can see the one blister that's kind of in his web space. Like it's actually pretty pink in there, which is good. That means it's just a partial thickness burn. Mm-hmm. Likewise on his face, you can see where he had some blistering. But, and here's the other picture too, it's a little bit, you know, further along. I think that's like the next week. You know, you can see that these blisters have just basically turned to some scabbing. Mm-hmm. And, you know, overall I look at those burns, I'm like, these are not really that bad of burns. Yeah. I mean, they're significant enough, you know, because they're on the hand and the face. That does make them, you know, worthy of at least an admission to the hospital to make sure there's not other issues, to make sure that they don't get infected. You know, I mean, the burn severity appears to be pretty minor based on the pictures and based on his course. The location does make them a little bit more, you know, notable just because they're on the hands and the face.
Yeah, because you have to move.
Yeah. So, you know, as I learned more about this, I started to ask questions, and really, I kind of am the only one that's asking questions, and so you might wonder, why does no one have the same questions I have? Well, it's because you're talking about topics that are very complex. Like if you go ask the average even doctor about what is the proper, you know, treatment algorithm for burns, a lot of them don't really know. I mean, burns are kind of a black box, and so, you know, I think there's very, very few people that would look at what's been presented and have any questions, but it just so happens that I'm one of those people, that I've had that training and had that experience. And so the first thing I had a question about was the fact that he was getting hyperbaric oxygen therapy. So can you roll that first video that I have? It's actually the guy talking about the treatment.
It's exclusive video of Leno in a hyperbaric chamber undergoing treatment for the severe burns he sustained in that terrible car fire.
When you talk about the hyperbaric chamber, how critical is that in treating Leno and other burn patients?
It helps decrease swelling, it helps increase blood flow with good oxygenation, and it helps decrease bacteria.
Dr. Peter Grossman is Leno's lead doctor at the world-renowned Grossman Burn Center in Los Angeles.
So there was another video too, and I wish I could have found it. I found it when I was doing my first research and I could not find it. But the other one said that he was getting that hyperbaric twice a day. So right off the bat, when I heard that, I was like, whoa, that's really unusual. So I did want to take a minute to talk about hyperbaric oxygen therapy. Have you guys even heard of that?
Yeah.
Yeah.
Yeah, I've heard of hyperbaric chambers before.
Okay, awesome, great. So I did want to talk about what hyperbaric oxygen therapy is, and I can actually tell you about it. Throw up that next picture, Travis. I am certified in hyperbaric therapy. Yeah. Well, because hyperbaric oxygen treatment is done very frequently at wound care centers. Mm-hmm. And so as I've told you guys many times, I've been director of wound care centers for over 10 years. And so I got my hyperbaric, you know, training so that our wound center could do hyperbaric therapy. So I actually can talk, you know, pretty knowledgeably about it. So hyperbaric oxygen therapy is essentially where you put someone in a tube, and that tube has 100% oxygen. So oxygen, like in this room right now, is 21%, just for baseline. This tube has 100% oxygen in it. Also, it has increased atmospheric pressure. So right now we're at 1 atmospheric pressure. In the tube, it's usually around 2 to 3. So not only is it a higher percent of oxygen, it's a higher pressure. So what that does is it super saturates your tissue with oxygen, which we have found does have an improvement in certain types of healing. Not only that, it can reverse certain diseases, and we'll talk about which ones those are. Now, the therapy is a little intense. Usually a person would go to one therapy a day, maybe 4 to 5 times per week, and they would do that for maybe 4 to 6 weeks. There's kind of a regimen for each individual thing that you're treating. There are some risks associated with it. There's some straight up risks of things like barotrauma, which means that your body takes damage from the pressure.
Yeah.
Like you can bust your eardrums, you can get like a punctured lung. There is like catastrophic risk. There are reports of hyperbaric chambers exploding because it's high pressure oxygen.
Yeah.
If like a flame were to happen to be lit inside that tube, it literally detonates like a bomb.
Oh
And
my
that
goodness.
has happened in there. It's not common, thankfully. It's very, very rare, but there are incidents of hyperbaric chambers exploding and killing not only the person inside of it, but people around it.
Yeah.
The other issues that are more realistic, like one, having worked in hyperbarics, like it's hard to get insurance to cover it. Like there's very few things where it's easy to get covered. I'd say the easiest common thing would be like diabetic ulcers that are resistant to treatment. There are things, and we'll go over the list in a minute, that are a little bit easier. The other issue I have is really the improvements are pretty modest. All the research shows that hyperbaric helps with healing, but it's not like a miracle cure.
Yeah.
When I worked at the level 1 trauma centers where I was running the burn unit and doing the wound care, we never put people in chambers. Why? Because we didn't need to. Well, we can heal them without that.
Yeah.
So I did want to go, I have a video actually. I want to show you guys a hyperbaric chamber. Can you roll that next video, Travis? Oh, thanks. Jeez, I was trying to talk to you. Let me get out of here. I want to tell you about this machine. So this is a hyperbaric chamber. So what it does is it uses increased oxygen and high pressure to force oxygen into the tissues to allow very difficult wounds to heal. It's also used for other things like carbon monoxide poisoning, but here at the wound clinic we use it mostly for wound healing. When the patient's in there, instead of shouting like I did, we can talk to them on this phone. So they get the treatments, it helps their wounds heal, and it's just another tool that we use to help people get better. So that was just me at my wound clinic talking about hyperbaric. It was just like a little, thing
How
I put
long do
on.
you have to stay in there?
So it's it varies depending on what you're treating and like the settings, but like 30, 40 minutes. It's not like all day or anything like that. Yeah.
It looks like you can watch TV in there.
You can, yeah, there's TVs in them. Yeah, there's definitely TVs.
Take a nap.
So I did want to list out like the reasons for hyperbaric therapy to be used. And so this is straight from Johns Hopkins, which I wanted to find, the most reliable source because there's a lot of different, lists out there. So carbon monoxide poisoning, cyanide poisoning, crush injuries, gas gangrene, decompression, which would be like the bends, hypoperfusion, meaning like acute arterial hyperperfusion. If you have like a flap or graft that's doing unwell, it can help it. Osteomyelitis, which is bone infection, radiation injuries, necrotizing infections like the flesh-eating bacteria. Air gas embolism is also like the bends, and then severe diabetic wounds. So what you'll notice is not really on there is burns. And when I heard he was getting hyperbaric therapy for burns, I was like, wait, what? And I was like, maybe like there's some new study out that shows that that's helpful, because really there's no burn units I've ever heard of that use hyperbarics for burns. And so I did a literature search again, and I pulled up some studies, and you can start putting them up there, Travis. Like the first one, little evidence that burn patients benefit from hyperbaric oxygen, no consistent benefit. The next one says that it's basically controversial. There's insufficient evidence to support or disprove. The last one, current research are conflicting, and it remains controversial. And so these are the current research papers out there about hyperbarics. So I have questions about that. Like for one, I can't imagine insurance is paying for that. I don't think. We have problems getting like legitimate reasons covered for hyperbaric. So it's like, are they just doing it as a service? Are they charging the patient for that out of pocket? I don't know.
That's immediately what I thought.
Yeah, charging out of pocket. Yeah. So so that was my first concern. So my second concern comes with the next part of that video. Can you roll it, Travis?
In addition to his hands.
Is it accurate to say he's had or will have skin grafts?
He has had skin grafts that are not his own, meaning skin that we have in our skin bank. from donor skin. That's what we initially do as a first stage.
He says Leno will undergo another surgical procedure later this week.
So I had like a real question about that too. So what he's talking about is human allograft, or at least the way he's describing it. I mean, I guess he could be talking about something different, but human allograft does have a place in burn care. I've used it a few times. The thing is the literature and just like the standard of care for using allograft is it's only used whenever a patient has like a severe like 3rd degree burn and like their skin is charred and you have to cut it off because it's a risk for infection. And then you put an allograft on top of that as a temporary coverage. Like donor human skin won't take like your normal skin.
Right.
So what you do is like for somebody say, remember we told the story about the guy who had a 90% burn?
Yeah.
We put allograft on him because, you know, we had to strip off all that dead skin and we didn't have enough of his own skin to put on. So we put allograft on there in the meantime while we piecemealed his own skin back on him.
Yeah.
You know, that's really how allografts are used. I've never heard ever of anyone using allograft for a partial thickness burn, which is what Jay Leno had.
Yeah, and he had plenty of skin on his body.
Right. Well, that's exactly right. But he didn't have a you know classic skin graft because he didn't need it. Like these are burns that are going to heal. So why in the world would they use allograft? Like that this doesn't make any sense to me. So then I was like, well, maybe he misspoke. I mean, I don't know. Like it's just odd. Like to me, as somebody who knows a lot about burn surgery, like using allograft for a burn that really is not severe, because like I like as someone who's seen horrible burns, like if I was going to rate burns from like 1 to 10, I mean Jay Leno's burns are like a 2 or a 3. I mean they're partial thickness. Like you know it would be acceptable to go to the OR to debride them. You know that'd be fine. I mean you could probably do that at the bedside, but you know for something that's not full thickness to use human allograft, it's just unusual to me.